Hello, everyone. My name is Senator Marie Alvarado Gill, and as we observe Mental Health Awareness Month, I am honored to share with you an important initiative. The Assyrian Wellness Collaborative, in partnership with Stanislaus County Behavioral Health Recovery Services, Prevention and Early Intervention, is steadfast in its commitment to reducing the stigma of mental health and raising awareness of the significance of well-being in the Assyrian community. Their approach emphasizes cultural competency and sensitivity to guarantee access to care is available when needed. The hope is to identify these barriers and work together to create meaningful solutions to serve individuals who are at risk of serious mental health issues and their families as well. Thank you for your participation and willingness to make a positive difference in our community.
She was my mom. The legacy that she left me was a lifelong love. My mother had dementia. When you reach a point in life where your loved one has reached that stage, in my case, a 95-year-old mother, that you need to turn someplace, and it's wonderful that there is a place to turn to, and that is a place like Bristol Hospice.
The staff with Bristol Hospice are angels. They're very caring, loving individuals that care about your loved one.
Having been a nurse for over 20 years, I've had a lot of different experiences. I've worked the acute, I've worked skilled nursing, and of course hospice. Being chosen to be involved in someone's care during their last days, for me, there's no bigger honor.
Without hospice, I would have been lost. It was a trying experience to begin with. The journey with hospice was very positive. You felt like you had a support group and you had all these people to take care of your loved one.
My husband, Paul Leonardo, passed away after about a 3-year battle with cancer. I knew my daughters and I wanted grief counseling, so I found it at Bristol. And it has completely changed my life. It is exactly what I needed.
My name is Audrey. Art passed away in March of 2013. Then I found myself being very sad. I called, made a reservation, and it was just the best thing I've ever had. People were so professional and so loving. I mean, it was a personal thing. Great opportunity to heal. And that's basically what our loved one would like, is for us to heal.
I would definitely recommend Bristol Hospice. I had the ability to take care of my mom at her latter stage of her life, and that was a real blessing. She'll always be my mom. I love her then, and I love her today.
شامل هون گشکان مغبه پرجان مغبه أنا إيفان جاند أتانوس ودي بتاعك يبتفتح هون كمثل كما دقيقة يخادك ترابا شابرتا خاخوزارا شابيرتلن خادك ترابا بريشتا خزيتونن قد شمو إلى بريستول هاسبس هجتت أديو خجت شاتوني لا خجت ياكورتا هجتي لا إن بخشابن رابان كيت لكت كلن ميدال يلبخ وبزبط ملبخ كخاك دوخينا رابا بغدان كدو دي لختيتن بدابي مني خابر سبتكت إلى جورت دا هاسبس مدخلنا الشمو وبزي خاجبن كأطرايا اتجانن عزيزة كت خارتا من دون بتهمزمن Hello dear, my name is Janet Atanous and I would like to welcome you from Assyrian Wellness Collaborative. Please introduce yourself to our audience so we can start asking you some questions.
Thank you. Thank you for having me. My name is Brigitte Lee.
Okay.
And I am the Executive Director of Bristol Hospice here in Modesto.
Okay.
Yeah. So our company has been here at least, I would say about 10 years. And I have been with this company about 3 years. So our service is really the goal of care is really to provide care for patients who have terminal illness and keep them comfortable at home, a nursing facility, or assisted living care. So all kind of venue.
Okay, wonderful. We have never talked about the end of life, and in my opinion, it's a very important subject to talk about and to be familiar with the end of life and the choices that we make for our loved ones or ourselves. So I'm very, very pleased to come here. You have a wonderful facility in here. I've never heard about the facility because I live in Turlock. But it's a blessing that we have such place for our loved ones. If there is a need that will exist, one way or another, we all gonna end up somehow at the end of life that we need to be aware. So our goal is from Assyrian Wellness Collaborative to learn and to teach the members of our community that there are choices and there are places that are available for our loved ones when the time exists. So I really, truly appreciate that. If you want to give me, in conclusion, a few other words of wisdom that you have, we would greatly appreciate that. And then I will speak with Johny in Assyrian.
Okay. So as we say, the end of life, the discussion of end of life is never easy. Who can coping with death and dying? It's very difficult for all of us. So we have a group of nurses, chaplain, social worker, CNA, and when we provide care, we just not only provide not only physical but also emotional support,
Right.
Spiritual support, because ultimately, at the end of everyone's life, what do we have left? We have only faith, right? And that is something that's going to help us go through the journey, not alone, but with someone else that helping us, that be there for us. So hospice services, I think is a great service. And I think it's a blessing that this country offers this service to everyone, and it's for free. And so,
It is for free.
It's for free. It doesn't cost you anything.
Wow.
And so, and you get all of the support from all levels. And you have nurses, stand by 24/7 for you. You have a doctor also stand by 24/7 for you. And, social worker and, chaplain, clergy, you have all kind of discipline that's always available for you 24/7. It's a wonderful service, and I cannot say enough of this.
I really appreciate that because I believe that the end of life is integrity, compassion, kindness, and understanding.
Yes.
Just as you mentioned, because it's so difficult for someone to go through this process, but it's something that we were all born one day, and one day we have to leave this world.
Yes.
And what a blessing it is that you have mentioned you have chaplaincy and the care of nurses. I highly respect all the nurses because I worked in surgery myself for surgical prep for 30 years. So I'm very aware of that. But it's a blessing to have this much care to be given at the end of life to anyone who is in need of it.
Yeah.
So again, I feel that it's honor for us to have met you. And hopefully, if there is any need for us, or if we have any loved ones that are that have the need to be contacted or to be brought to your facility, we will contact you, and then we can together share this love and kindness and compassion, and try to make it easy for the family.
Yeah.
My husband, Paul Leonardo, passed away after about a 3-year battle with cancer. I knew my daughters and I wanted grief counseling, so I found it at Bristol. And it has completely changed my life. It is exactly what I needed.
شنعملو هون گشکانه پرجان مغربه مدري أنا إبن جانا Atanous بتاعي قبت فتوى هون قمت خد كما دقيقة هرت خد كم تهم زملي لشانة إنجلس من خامتة كديبة Executive Director of Bristol Hospice أدي باين هم زمن مخا جوانك آتورايا قد لخا في الخانة لي آمون كديان بيابل كمانو هارو بدا دكتا باين قبل نفشين عزيزي جوني Beitsayad رابا بشنتيت رابا بغداين بتفكت ديوخ شابهورن بديوخ عزيزي خواهش فادن خدش بودجانو همزم بودا دكتا همزم Bristol Hospice packet
Bristol Hospice yes نطلع شنا اخر بالخانن
اوكي
ايضا بابي شيل مرايا جانو راب من يعني لخ ببار مويا لخ بدا ايكا شارخ و كل ان خبرانه قديان راب خبرانه جورفا شوينا باليابو بلاخ من ناشه خارطه فيري جود شولا قد كمسن كناشه مخ جانن هايرن ادي قد راب ذا سباي ليبون جاني تخمون مخراب سباي ريسورس كناشه جانن بداين قد راب ناشه قدام اللي جانينا كذا سيتويشن
هل هجت قد باسو همزومخ إلى خدش ياكورتا but the end of life we're speaking about the end of life خيك مدان I appreciate ملت دي ان رابا تشاتون إلى قابل قبل خلا خبر سوبر مريالة خنا practice خينا إتها مو بتودخ مو جرك ودخ مو كماسة ودخ إني أنا بقريات رابا أنا كاينة قد خيك مدان أي ألان رابا كخلصة ليتخ من ماي بقرا ميكا هايرتا طالبخ یم بلکه خشوه هایارتان ایلا من خپنتا اینه هرت خد بدایتون سوگلی پرجان مغرب خورس دیان همه شویه لکد اخنا گانن بلیابخ خارتا بایر ملپخ که هدامت امتن يتبريشايد هرت خد ملي آمندي هجت خجي ياكورتلا إذن خانة شمرايلك بدايخ يعني خنا تشارا لتن أنا شاب يعني برسوبا بدمن يخي يتخب جابو خرجتن زوزي رابع عن كاينة قد بتاينا خانة شد برشلة جو هاسبس جو هاسبيتالز حكيمة بيت قرباي تشمشتا إني ناش اسن رابع ألان بتلاكلا ألان تالوك أورجانا إني بيان تيان كد لا ألان لا تلقى خجة دختاني خجة سبرخ سلوتا صالح رابع بغداين كد قدا أطرب بخايخ على هبور خاني لجاني جان رابع مديانة تنقدا أطرب الكي جو أطرباتت كد إخنا بريخ جابتيخ لتن خامنداني دكتلا كد بالخانت compassion دختاني integrity help كومد بيتانتك قارت رابا أنكيت لكد هيفي لتلن البات أرا إن إتن برسوبي كد كماسي كدين هايري أرخاز أخلا ميدالة خاش فادن همزم بدا kindness كد أخلوهن إتلوخن همزم مجرك شارخ خبرسوبا بمريا how did they contact you financially, physically? What are the situations and how to go about that? Please.
Yeah, Rabba's by question ila. Kisharia idan family accept vadona kad
Kabulona.
Dus kabulona kad anasha labuluch maraskhana in a bitayle midde bedarich maraskhana. Hebrishlich bitayich. Dumanan in ena placha. Bush raba problem baila in a raba solution litlan. ناش دانت مارن مود خلق بيها مشابخ يمارس خانة أنا شد رابط تخبرتو رابط لجيبتها.
Okay.
أيضا مطايتون أدو جيدا قد لك بداخلنا مو أودات أي لدانت هاسبس. هاسبس أيضا تبدأتها جيبتها و أناشا بتخبراله. CNAs بشادري. CNAs كده أناشا بلكي طلع جاي شبتها خمسة جرى شبتها كده باسوبر خابي. ماتي شيف دودي توبرياته انميانه كدرابه ياكويرنا على كلبات
خدامة كلبات شو
دوس ورابطك انتجريتي لما خيانك مرخ
هلبته.
جورا للا بيا بخت خلاله كلبت للا بيا جورا خلا انا من يعني
يعني there's a sexuality كبرونا لمس كيما إذا ما ين بحالتها همزومة غنا this is reality ين diaper شخلب هرت خيان خبرات لمصال متيال بابو هي انخبتها جابوتن so that's wonderful كده خنون اتلقون resource كماسيتون شجيتون لبيتا packet
yeah that's beta so the idea إلى جان كد بيتا ودخل كم كربد مرسخانة كد كمسخ
okay
كارافات بشادرخ أنا من يعني كد لازم wheelchair oxygen درمانة CNA بدأتيا هرمك hospital بدأتيا بتمزالة patient دازا خارت nurse بدأتيا nurse بدأتيا درمانة prescribe دودا train دودا على family مو ديتون in between visits and then أخن لخ هالقدمة مو ديتون 24/7 number بيا ميخا emergency villa قاريتون كديان local ياكا hospice company شادي خا nurse ميجيب دازيتون مرس خانة بلالة so رابع خامويلا patient beta ورا مطايلة ألو خارطة درامن يعني spy social worker يابنا
okay
أيو social worker رابع spy لا because I don't know how you like a family can then about benefits أديا IHSS hours
okay أي رابع إنك تلسب رابع من أمتن كامي أباهاتي نانون تسابونت لون جبتها ماشنت لون ينخناش مرانت لون إتلون صات من IHSS إتا لبي إني صات كتيلون سب that's really financially that's very important كحكمة كالبتة أديه دون إخرون عتيتون مسألة شرخلا أورقيو hospice ديوخون مو كويا بعدز إن أنا تيبورن كبابي إتلي 5 ساعة IHSS إذن hospice بتاعي بيتها خنا أنا أشولا لم بعدو إحنا هون أشولا بعدتون كبابي أي مجربة إلى أي هكذا بتكالي يعني هكذا أنا بشكلنا
IHSS hours كله إنا ديوخن أخن شولتنا in fact أخن بجربك social worker ما سكلنا hours possibly كم شيء شكلي كرب تمو 8 طلا أدخل كربة
واو ساعته
تمو 8 طلا ساعته يرخرا وناش بشكلنا أتشا خرط بلاشنا بشكلنا إمو تلاي أربعة خدشة مزيودة أنا كدمان you know the national viola hospice تخبرتو بشرابة viola
دوزيلس 24/7
okay so عادي بشرابة caregiving ميخ so IHSS hours هجدان إذا لا مخا خلا
that's wonderful
out of pocket lit كfamilies
okay
I don't actually medical medicare social worker بجارس شو زارزله
okay
so
يعني خنا خرج لتن additional خرج كت hospice يبخ
من جيبة لتن no
بس in parsupet قدتلون Medicare and Medi-Cal they qualify for hospice care دوزيلا
well everybody insurance wise qualify KOD if clinically qualify OD
I see
so if at clinically even hospice appropriate add on to Shunanak Zerzi
oh okay
automatically depending on company لما ذاك company you know Bristol but dying no out of pocket أنا لين خزي خانة خشب باسوبا من جيبو باره
but it's clinically you have the patient has to be clinically qualified for hospice care
دوزيلا
robust way and that includes at any age
yes any age Rob a good question
مثلا accident villa catastrophic accident
دوزيلا
يالا براترك من 15-year-old you know 10-year-old
كويا كمان أجهزة اللبة إلك دي عندك اللخ كبلخخ إنك يخزخون أنا من يعني إلك أيضا خناش clinically إتلا under 6 months less of life
I see
رابع إتلان patients قد 24 من عنينا
really
because cute 6 months كده revisit أودخ إن أنا عشان بوش خربة فيله كامس بايش and same إله كامس بايش you know أنا بوش باي فيها right أيضا تلالي لازم hospice إن أخاك بدنا شيء كابي maintain هذا دكتور كبلا باشنة خدشناش أسرة ديك
yes
ككلك شخلبها
yes
in qualified EVIT as long as qualified EVIT that all hospice services
and in hospice care you gamarani kiabituna oxygen to be kept alive
yes ma'am yeah كودخ مودي لازمية إلى so Robert great question بكرة hospital bed wheelchair walker overbed table oxygen درمانة supplies and briefs بالفاشنة
of course
and رابط family problem هنا
yes
قصدي مانا دقينا
رابط ديماننا
وشخلبته رابط زحمة ديلا so سبايلا دان خناش بي تايل بعدو رجع كلبات كم سا أويا كلبات أخن كم سا أبخ clinical
Of course.
you know you do your job أخن ودخ our job وك integrity patient راح ديلا
دوزي لسبخة كما من إن حالا دختاني موخة بالخانة اللي they are still with us. انخبتها اتن ملت دي حاجة ناجبيلا اللي بويخ انخبتو يا نارها توتبريا بالكلبت إن راه بغداين جاني جان قد أتمن دوز على برخاني اللي كت بكلم بويدالو سبب أهرابا عن انكيتلا هلت خدمري ناشا بدا مبتت يبريشن يخيوتن إن لخا رابا بغداين كت بكلن داخل organ donation خجة باسو همزم سب أنا جاني كلبتي كلها إيفر organ donors أي دخا هجت رابا ياكرت لك ملتديا في الشيء ملتديا to be able to say I'm an organ donor إن بداين غزيتم بين دجاني كما أنكيت لك ما يعني بركات لدن خانش من يوخله هدامت بارو بيشي دويخه ك 8 أسرة برسو بخينة إتلن من كوسا هير من عينة من كيدنيز من لانجز من هارت رابع مديانة تنكت كم سامة جلدة سبانا جمانا سبانا ديان burn patients yes أني كل بركاتنا إذا خانشة من يوخله تشاتوني لك أمتديا تانا أخن لا بيخ إذا ما خغال بارو أني مديانة شكل خلون إن هرديدان كت برسوبة خايلة إخلن كماسخ أني مديانة هدامت بارو شكل خلون هلبتا من جو hospital جو hospice بدير من مديانة كت أبي for organ donations هيج كده من دياتن فيت كت كبتا من دي كوبلونا فيدونا
إذا دانت admission بعدوخ أني كل من يعني باكوننا باكري ناس بيعرف full code يا DNR أي رابع important topic إلا
yes
إذا ناس يدي دانا بارنا رابع ناس معنا نو بياخدك resuscitation full code يعني كم سخ سيفو دخ سيفو ده
شو مد لازم إلى أودر كمارانا قد باش خايا
إنا also بياخ explain أودر قاته because I did give you example خناش رابع frail إلا
yes
كل بد imagine إلا
Oh,
CPR بالكد لا the best idea كدوناشا.
جرم بشمتي ما خذ صدره.
ورابا أجزانت اللي بقي لك family إذا بغزاينه وناشا بار resuscitation.
Of course.
So أنا يعني educate دخلون كاته كد لاخشي تاني yes because they think it's the right thing to do. You know they have to be educated. خارت رابا ناشا change كودي. So we'll talk about مخمرخ donor أنا من يعني we'll talk about DNR full code. So family can make organized decision. We support donors because خزيخ miracles.
Yes, it is a miracle.
And it's like anasha munichle ina khanasha khina rushle.
Yeah, khanasha khina bkha. 8 nasha khina kam si khayi.
So there's a blessing you kilimindi.
Yes.
You know.
Wow.
Ina sama zoda hayarta ila. Kay nasha yanan bayin yati kat it hayarta o pride and minyana metakhun merza. Raba hayarta it kay nasha yanan.
Allah barik lahu Johny John. This is a wonderful topic. Sabana gyani min raba kashahum zimtin kasha Amerika bzib kashet min letadyanan. قد أمن دي ليلة خلطة ليلة خطيطة حكمة معنا our community it's a faith-based community أطراية
big time
البل لا خطيطة لا وشو لا دخله على بريان دي جري هرتها يعني أزخ إنه أو من دي أنا لم بخشى بخطيطة من كاشتك تهنزمتن absolutely not because you're giving a gift of life هرتخت blood donation with your blood you can save so many lives so definitely هم بركاتنا من على أخلن كابولخ هم ده بركاتنا كد كما صغير بخلون كشبت من ياجنا خيني كد إن بي أبي organ donors إن را بغداين كد أدلخ إيفد عزيزي مجرد كماسي نأمتن إن على لابد خامندي تيلي خخزاجة تيلي and there is a need that it comes into existence. How do we contact you?
Directly. أنا همش a personal cell phone دي كذا.
كوي نخاني ختاني تلفونه.
Yeah. 209-596-5066.
رابط باي أي تلفون إيدو خيلا يعني هم شبتو يا منو خنا
بسیار پاشا
يس شمو إيلي
جانی بتساید
Johny Beitsayad بس لا مقبليتون سوغولي Rawa Bagdain again, Shavhuran Bidiyuch. Honestly, I am really blessed to have met you.
You too.
Because Edan Gani Guda field even, I know how it is. It's time for compassion again, integrity, kindness, help. Help get خكبنا شلي ماسي بقري يمكن أخبي إن قدام دي على هبرياني لك كلن خايفخ كلن سنيك دام دي بخ هريت خدانا همش من خاتي كارمن كوين هم زمتا از استوديو لا مصلوية منن إن بالخانة ديان إلى جانا يلبخ خرطة ملبخ and it's at no cost.
I love it.
Yes. مدري أبيتون باسيمة برجانة مغبة كش كان مغبة كد شريك روخن منن كدا خرزة رابا شابيرة خا خرزة كد رابا منتيانا إلي ديش دي مويلة منتيانا كد إذن خايت خمندي كبوملا هرت خمري على برخاني اللي قدات رابا خايخ اتخدو كنانة تنكد كماسغ آتر خيارتا طلبخ هرب ديدانا إذن خا برسوبت عزيزا هدامت كلبت من يوخلي كد أرخاتي تن كماسغ هدامت باغران دو خخلون كبرسوب خينه بس أبيتون مدري روا باسيمي كجيشك توخون ماشمه توخون عزيزي اتلوخ مديان خارطة قد بايد تانت in closing do you have anything to add in English as well?
Yeah, it's kind of
Please.
misconception about hospice.
Please.
Yeah, thank you.
Sure.
Hospice ila aggressive pain management. That's
Okay.
it. The job is to keep patients out of the hospital for something the hospital can no longer treat.
Okay.
Another thing is أخنلي بخدرمانا قد rush عدد transition process.
Okay.
ولا شكل خدرمانا من patients قد خاموية alive.
I see.
So a misconception قد hospice إلى مخ pulling the wire.
He.
لا a time of death is between you and God. أخن we don't mess with that.
Okay.
أخن all we want to do is keep you comfortable between now and that time.
It's comfort care.
That's
all the
it.
way to the end.
That's it. Nothing more, nothing less.
Okay.
Okay.
Well, Abidra Basima again.
Thank you.
Khaltala, we will meet you again.
Yes.
And if there is a need, we will call you. Abidra Basima Azizi ala barakhlo.
Thank you for opening
Thank you
your
so
platform.
much.
Thank you so much.
Abitun Basimi gishkan mugabe khaltala btabkh biyokhun yukhrzet khini ktabilan. Pusham shana.
She was my mom. The legacy that she left me was a lifelong love. My mother had dementia. When you reach a point in life where your loved one has reached that stage, in my case, a 95-year-old mother, that you need to turn someplace, and it's wonderful that there is a place to turn to, and that is a place like Bristol Hospice.
The staff with Bristol Hospice are angels. They're very caring, loving individuals that care about your loved one.
Having been a nurse for over 20 years, I've had a lot of different experiences. I've worked the acute, I've worked skilled nursing, and of course hospice. Being chosen to be involved in someone's care during their last days, for me, there's no bigger honor.
Without hospice, I would have been lost. It was a trying experience to begin with. The journey with hospice was very positive. You felt like you had a support group and you had all these people to take care of your loved one.
My husband, Paul Leonardo, passed away after about a 3-year battle with cancer. I knew my daughters and I wanted grief counseling, so I found it at Bristol. And it has completely changed my life. It is exactly what I needed.
My name is Audrey. Art passed away in March of 2013. Then I found myself being very sad. I called, made a reservation, and it was just the best thing I've ever had. People were so professional and so loving. I mean, it was a personal thing. Great opportunity to heal. And that's basically what our loved one would like, is for us to heal.
I would definitely recommend Bristol Hospice. I had the ability to take care of my mom at her latter stage of her life, and that was a real blessing. She'll always be my mom. I love her then and I love her today.